My name is Marla McGinnis. I will be the moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Marla. Good morning, everyone. Before we get started today, of course, I'd like to start by talking about the situation in eastern Nova Scotia and Cape Breton as a result of yesterday's storm. Pretty scary situation there for sure. The Nova Scotia Emergency Management Office is working with the affected municipalities and other partners, including the Department of Public Works and Health and Wellness, to coordinate response efforts in Pictou, Antigonish, Inverness, and Victoria counties. So we urge people to please check with your neighbors, excuse me, especially the seniors in your community. And we will continue to work with our partners to keep Nova Scotians safe. And my thoughts are with all the residents of the areas impacted. Now on to COVID. I want to acknowledge that yet another Nova Scotian has lost their life to the virus since we were last here. My heart goes out to their family and to their loved ones. If ever there was a reason to get vaccinated and to follow public health measures, this is it. As we continue to see lives truly do depend on it. And in a few moments, Dr. Strang will update you on the situation with COVID in Nova Scotia. But for me, I'm pleased to say now that things appear to be stabilizing for now. Public Health has advised us that the outbreaks in the northern zones and the western zones are under control, and cases in those areas seem to be trending down, which is good. In other good news, appointments are now open for those eligible to book a third dose, and we're expecting vaccines for children aged 5 to 11 to land in the province this week. And the team is putting the final touches on the rollout. Parents and guardians should be able to start booking appointments for their children very soon. The benefits of the vaccine are clear, regardless of the age. In this wave, we are seeing more cases in children. So please get your child vaccinated to protect them against the virus. Protecting them also protects their family, their grandparents, their friends, and their community. Thankfully, the choice to get vaccinated is the choice most employees who look after and care for vulnerable Nova Scotians have made. Our latest update from the sectors included in our mandatory full vaccine protocol continue to be very good. Most employees who have reported are fully vaccinated. In fact, 95% of Nova Scotia Health employees are fully vaccinated, and another 4% have one dose. Over at the IWK, 99% of IWK staff are fully vaccinated. In long-term care, 95% are fully vaccinated, with 3% partially vaccinated. For home care, it's 95% as well. For EHS, 99% are fully vaccinated. And 97% of employees in the education system who have reported are fully vaccinated. So as for employees who work for the province of Nova Scotia, 97% of those who have reported are fully vaccinated. So those are encouraging numbers. We're paying close attention to the percentage of staff in all sectors who have not yet reported. But I know employers are working hard to determine the intentions of these employees. I'm concerned about this group that's not reported, and I hope the fact that they haven't reported doesn't mean that they don't intend to get vaccinated. But if it does mean that, we will deal with it. At the end of the day, we absolutely we're completely convinced that people who work in these sectors must be vaccinated to protect the people they care for. This is more important than having to deal with the impacts of staffing and services if people choose to leave, rather than investing rather than taking the life-saving vaccine. I will say that sectors are planning for, the employers are all planning for how they will handle potential staff shortages or service disruptions. But right now, there's no employer that is expecting any major impacts to service delivery. They have to deal with, and they'll have to deal with isolated issues. For example, in education, they're anticipating that there could be areas where busing is an issue due to driver availability. But these are all things that are being planned for by the employers. So we'll have the final update in early December. But I'm hopeful that we will still be able to say that we expected minimal impacts, and that's what we actually experience when the time comes. So we're optimistic that people are getting vaccinated, particularly in those sectors, and we feel that there will not be any major impacts on service deliveries, but we'll have the final numbers soon. So with that, I'll turn it over to Dr. Strang.
Thank you, Premier, and good morning, everybody. And my thoughts, too, are with those who have been significantly impacted by the weather event and the subsequent flooding. As of today, we have 172 active cases of COVID-19 in the province. And I also want to extend my sympathies to the family grieving the loss of a loved one due to COVID-19. While our overall case numbers may sound high, we are seeing some very positive signs. The epidemiology is stabilizing in the western zone. There are still some sporadic cases, but we have a handle on that. The situation in the northern zone is also stabilizing, but we do continue to see low levels of community transmission. I want to thank East Cumberland Lodge and the Nova Scotia Health Authority Public Health for working together to reduce the spread of the COVID-19 virus in that long-term care home. I know staff at the home have worked very hard to provide excellent care for residents under very challenging circumstances. In HRM, the cases are shifting from central Halifax into suburban and semi-rural areas in and around the city. Most cases are in children under 12. And that is having an impact on some schools, but with the rollout of vaccine for children aged 5 to 11, we can expect to see less activity in the new year. And we're fortunate that most of the illness continues to be mild in children, and vaccines will reduce this risk even further. I know parents and guardians have many questions about the vaccine for young Nova Scotians who are aged 5 to 11. As your Chief Medical Officer of Health, I am strongly recommending that all children who are eligible get vaccinated. While this virus does lead to mild illness in children most of the time, please don't take a chance with their health or the health of others around them. The rate of severe illness in children from COVID is similar to that of a number of other infections that we routinely vaccinate our children against, one example being polio. This virus spreads very easily and quickly among unvaccinated groups, and having children vaccinated will really help to prevent further spread in our province and protect those who are at greater risk of severe illness. It will also help us avoid school closures and the restriction of social and extracurricular activities that impact the physical, social, and emotional well-being of children and their families. Achieving good vaccination rates in the 5 to 11-year-old group is the next and very important step in moving out of this pandemic. And we are putting the final touches on our vaccination program for this age group. We're having the vaccine from the manufacturer repackaged into smaller shipments so it can go directly to pharmacies across the province instead of us doing this from a central warehouse locally. We are adjusting our online booking, data collection, and product management tools to accommodate this new age group and a new vaccine. We expect vaccine to start arriving this week, and once we have certainty of the delivery date and time, we will open up appointments, and this will be announced publicly. Pharmacies and the IWK Health Centre will be our main vaccinators, and they will be ready to start getting vaccine for children on December 2nd. So here are some important details around childhood vaccination. Children will still need 2 doses of vaccine and are considered fully vaccinated 14 days after their second dose. The time between the 2 doses will be a minimum of 8 weeks. Evidence now shows that a longer interval results in better and longer lasting protection. If your child turns 12 during the 8 weeks between doses, the second dose will be the age-appropriate adolescent or adult dose. And children aged 5 to 11 should not get other vaccinations and the COVID-19 vaccine at the same time, if possible. Other vaccines will need to be given 14 days before or after their COVID vaccine. And as the parents and caregivers, if you do have to make a choice, makes the COVID-19 vaccine a priority. If your child is 12 and older, they can receive their COVID vaccine and any other vaccines at the same time or closer than 14 days apart. I emphasize this point because we are hearing that some grade 7 and 8 youth are deferring their routine school vaccinations so they can get the COVID vaccine. This is unnecessary. Children and youth, like adults, may experience mild side effects like sore muscles, feeling fatigue, mild fever, or a sore arm where the vaccine was injected. This is normal, and it means the vaccine is working and teaching their body how to fight the virus. The IWK has some great resources on how to talk to your children about vaccination and tips if your child is afraid of needles. So I would encourage people to go to the IWK website for that. And a reminder, please do not call pharmacies directly looking for appointments. You can only book through our online tool, or if you do not have access to that, through our 1-800 line. If you don't have access to the internet, as I said, someone you can book for, or you can call. But there will be some wait, as this line has been extremely busy. And the same applies for people who are looking now for their appointment for the booster dose. So if you're at all able to, or have someone help you to make your appointment for a booster dose or for your child online, please do that. We need to preserve the 1-800 line for those who have no other ability to book their appointment. And speaking of booster doses, I'm pleased to be able to say that we opened the booking a day ago, and as of last night, we've already had 12,000 people book their third doses. A reminder to people that looking for their booster doses that you have to wait 6 months after your primary series has finished to get a booster dose. So as of today, if you received your second dose as of June 9th, you are now eligible for a booster dose, so you can please go and book. If you aren't yet eligible, you can still book an appointment, but the system will not allow you that appointment to be booked before your 6-month mark. Long days and colder weather are here, and that means more indoor activities for the next few months. This is when COVID-19 looks for opportunities to spread. And as the holidays approach and you start to get back out enjoying larger events like concerts and sporting events, we need everybody to be extra careful. Vaccination is the best way to protect ourselves, but the vaccine is not 100% effective. It will help you from becoming seriously ill, but following public health measures is another necessary layer of protection for all of us. And as much as I'd like to be on everyone's shoulder, reminding you to wear your mask or wash your hands, pointing out risk and helping you steer clear of them, that isn't realistic and actually sounds a little bit creepy. Each of us need to take responsibility for our own actions and activities. And as we move indoors and begin seasonal events and gatherings, this becomes even more important. We all know that the best ways to shut COVID-19 out of our festivities, whether at home or at larger gatherings, but we all need to follow these measures carefully and closely. Masks continue to be required in indoor public places, and there are a few situations where people are actually allowed to take off your masks in an indoor public place. If you're doing a physical activity that's difficult in a mask, like a fitness class, if you're actively eating or drinking, and I emphasize the word actively, it doesn't mean that simply having a drink in your hand or nearby during a concert or a hockey game allows you to take off your mask. If you're someone giving a performance as a singer or playing a wind instrument, no mask is required. If you're publicly speaking or officiating at an event, if you're having formal photos like an ID photo, a wedding photo, or a session with a photographer, if for some other reason you need to confirm your identity, and if you're in a courtroom, jury room, or security area in a courthouse. But with those aside, it's really important for everybody else that all of us strictly adhere to the requirements for masks in indoor public places. And that even if you're in one of those activities that allow you to take your mask off, once it's done, you need to put your mask back on right away. And it doesn't matter if you've shown a proof of full vaccination. It doesn't matter if you're seated or standing, how many people are present, or if you're keeping distance. The necessary and appropriate and proper wearing of masks is an important layer, especially as we move into more indoor activities and we have larger groups of people getting together. And I do have to note that the proper wearing of masks is important. You need to have a mask that's at least a 2-layer mask. 3 layers are even better. That properly seals around your nose, your cheeks, and your chin. I still see far too many people that their masks are below their nose. If your mask is not properly covering your nose, then you're fully allowing virus to spread out in the air around you. So in this 4th wave, having a well-vaccinated population means we're preventing severe COVID illness and limiting the need for strict public health measures. That doesn't mean that we can become complacent and allow widespread of the virus, however. So far in Nova Scotia, with a few exceptions, we are finding the right balance. But the next few months are critical. Please continue to keep being careful and responsible. Keep on doing what Nova Scotians have done since day one of this pandemic to keep each other safe.
Thank you very much. We'll now take questions from the room before going to the phone. Go ahead.
Just wondering, Dr. Strang, you say that the vaccines are going to be here this week, but you can't really say when they're going to go in arms. Why can't you?
No, I did say December 2nd is when we start going in arms. What we've said is we can't give a definitive day when people can start making appointments because we don't have a definitive date and time yet for delivery of vaccine. Once we know that, and once that's confirmed with our federal counterparts, there will be public announcements and using social media and other mechanisms to let parents and caregivers know that when they can start making their appointments. But we know we're going to get vaccine very soon. We're very confident that December 2nd will be the day that we can actually start vaccinating the 5 to 11-year-olds.
Will it be open just for the entire 5 to 11 age group, or will you go with like an age-based approach?
No, the entire 5 to 11. We've worked with our pharmacies. We have lots of capacity with our pharmacies. The IWK, because a large proportion of this age group lives in the HRM area, the IWK is standing up a clinic for this age group as well.
Dr. Strang, some provinces such as New Brunswick and PEI have already received their vaccines and have their booking programs on the go. I'm just wondering why the delay here or the perceived delay.
The key for the delayed delivery is we're asking at the federal level to, as I said, break down the bulk shipment into smaller shipments to go directly to pharmacies. Over time, that efficiency of shipping directly to pharmacies will stand us in good stead. We're also doing like we did when we stood up our adult program. We're investing in the infrastructure, our online booking system, our data collection systems, our biologic management, how we manage the distribution and supplies of those product. All of that is online. That needs to be tweaked to accommodate a new product, a different age group. We know that having that infrastructure over time proved its value. For Nova Scotia. It's not how quickly we start, it's how quickly, once we start, how efficiently and effectively we can get vaccine available for families and children. We'll have lots of ability for people to get immunized in the coming weeks in December.
Nova Scotia's courts are refusing to tell us if there are judges who are not vaccinated, and they won't even say what their policies are, what the policies are for courts for judges getting mandatory vaccine. I'm wondering for both of you, if both of you could comment on that, if you think that's appropriate.
You want to go ahead first?
Yeah, I think it's important that that those officials who are in our court system, that's part of our, part of government and agencies that work along with government, that we would expect that judges and other people working in the court system would be vaccinated like everybody else. We'll continue to work through the Department of Justice on this to try to understand any issues or challenges they may have.
I would say just on that, I would say that Nova Scotians judges play an important role in our society, but they're no different than every other Nova Scotian. They should be vaccinated.
Nova Scotians often don't have a choice on whether or not they're going to be in court. Is it fair to Nova Scotians that they don't know if the judge who's sitting in the same room with them is vaccinated?
I would. It's my strong opinion that judges should be vaccinated, and we're gonna dig into that and find out. But if we can extend the policy to them, which I hope we can, then we'll make sure judges are vaccinated. They should be vaccinated.
And finally, I'm wondering, Dr. Strang, could you tell me if the courts have submitted a COVID plan? Last year, employers had to submit COVID plans to your office. Do we have one for judges?
Yeah, through each wave we've had it, and then in the recovery from each wave, the courts have developed their plans that have had input from public health, and ultimately I get a chance to review those.
So have they submitted anything regarding the vaccination of judges?
I haven't had anything from them specifically about vaccination for judges. As the Premier just said, we have a position on that, so that they should be vaccinated like everybody else, and we're going to work with the Department of Justice and the judiciary to understand it more.
Dr. Strang, once the children start getting vaccinated, will the proof of vaccination requirement be extended downward in age to them?
So certainly not immediately. That our proof of vaccination requires people to be fully vaccinated. So 5 to 11-year-olds will take a minimum of 8 weeks from their first dose, and an 8-week interval, then their second dose. Given that, it would be in February that we'd start to have children who are fully vaccinated. At which time, then we're going to continue to look at the need for proof of vaccination in general. So we'll continue to look at, but certainly we are not going to require proof of vaccination in these early stages, because that's not fair to kids. They haven't had time to get fully vaccinated.
And that was my follow-up question. As children get vaccinated in large percentages, do you foresee a time when the proof of vaccination requirement will be dropped?
So we're going to continue to look at the epidemiology, and once we get to a point where large numbers of the 5 to 11-year-olds have had time to get fully vaccinated, maybe we're in a position where we don't need the proof of vaccination in general. So we'll continue to look at that. But I think assurance for the parents that we are not going to impose something immediately when they have not had the adequate time to get the 2 doses.
Dr. Strang, why not vaccinate kids in schools, given that you've shown hesitance towards the idea?
So we worked through this. I mean, for a number of reasons. That one of the key ones is we have a well-developed and a well-proven efficient system of vaccination, large numbers of people through the roughly 250 pharmacies across the province. It provides an opportunity for parents to be with their children when they get vaccinated. The logistics of immunizing multiple classrooms of kids in a school. We do that in our grade 7 immunization program, and even that has its substantive challenges of disrupting a school. Doing every grade from P to 6 in a school has much greater challenges. So we've worked with education. We'll certainly use schools. So our approach is going to use our proven pharmacy model. Part of which allows us, one of the values of that, we have all the online booking system, the data collection systems. We can closely monitor our vaccine uptake at a local community level, and if there are indications that some communities may need additional supports, we may use the schools. We will certainly look at things like our mobile units in partnership with schools to provide additional opportunities for children and families where that may be necessary.
Premier, I'm going to give us a snapshot of what's happening in eastern Nova Scotia and Cape Breton. We know roads are cut off, communities are cut off. What are you doing? What's the province doing to connect these communities? What's the timeline on that?
Yeah, I think the last information I have was there's somewhere in the range of 3,000 people without power, but certainly huge impacts on roads and bridges. There's no question about that. We have Public Works is on the ground there, kind of analyzing the damage, and we'll try to determine the path to restore some of that. We're particularly concerned about some of the, there's people without access to EHS and access to medical services. So we're deeply concerned about what's happening there, and there's a significant effort to properly assess it and then come back with like how do we get things corrected up there. But I will say that the federal government reached out immediately this morning and offered that should we need some assistance that they'll be there for us. So right now it's first priority is to make sure that every Nova Scotian has access to should they need healthcare, should they need other support. But assessing the Public Works is actively assessing the full extent of the damage to roads and bridges, and we'll have some more information on that after that's done.
Has there been any progress towards issuing fines to other organizers involved in the Amherst Faith Gathering? Are you looking still to find additional organizers in addition to just Robert Smith?
I think the investigation is still ongoing as to how broadly we can reach out there. So I would say it's still an active file.
Dr. Strang, is there any way to quantify the impact of that gathering at that Baptist church at this point in terms of the spread of the virus in this province?
We could certainly go back and look at actual numbers of initial cases and secondary cases. We know that there was a large contribution in the last 2-3 weeks that drove a lot of the case numbers that we were seeing in Western Zone, as well as some the impact in cases in Eastern Zone, including the East Cumberland Lodge, including the residential care facilities. So there has been a significant impact in terms of the actual case numbers. I haven't sat down and done the math and give you a total number of cases, but there's no doubt it was a major driver of transmission in both Western Zone and Northern Zone in the last few weeks. Fortunately, that is coming to an end, and things are much more stable now.
And 4 deaths have been attributed to the spread from that gathering. At least that was the last information we had. Is that still the case? Have any other deaths been attributed?
No, just the 4. Unfortunately, I shouldn't say just the 4. Four deaths are 4 too many, but no more.
Going back to Cape Breton, is there any early indications that you may have to apply for federal disaster relief under that fund that they have?
Yeah, we're certainly not ruling it out. But I mean, if you've had a chance to see some of the pictures and hear some of the accounts, there's pretty extensive damage there. So, as I said, we'll assess what's necessary, and the federal government has already reached out to say they would be there for support. So we won't hesitate to take them up on that should it be necessary. But right now, first priority is really make sure people are safe, and then assess how we go forward.
Dr. Strang, with the vaccinations for children, I'm wondering how it fits into the overall plan to get as many Nova Scotians as possible vaccinated. How critical is the child component to that?
I think it's very important. We have 65,000 Nova Scotians who are 5 to 11 years old. We're seeing, especially in the Halifax area, where we certainly have the majority of people in the age group live in the HRM area. The most of our cases happening in the HRM area are kids who are in that age group, and it is impacting some schools. So certainly by having good vaccine coverage rates in that age group will be a major addition to our ability to limit the spread of the virus. And as I said, it's not just about protecting kids from getting severely ill. They can get severely ill from COVID, but it's about also their ability to spread to others who have greater risks for severe illness. And I think when people think about children's health. We need to acknowledge that many of the necessary things we've had to put in place to limit the spread of COVID, whether it's closing schools, restricting activities, have had substantive physical, social, emotional impacts on children's health. So the way we get out of this is having those kids vaccinated. So I think we need to think in broader beyond just about the risks of the virus and any possible risks of the vaccine, and acknowledge that having our kids immunized is a substantive benefit to their health and to others by playing a major role in, as I said, the next step in really achieving the highest possible vaccination coverage rates, which is the way out of this pandemic.
We're going to jump over to the phones now. We'll start with Daryl Cole with Amherst News. Go ahead, Daryl.
Hi there. My question is for Dr. Strang. Since September, there have been dozens of COVID cases at an Amherst area school. Parents report receiving close contact notices nearly every day, and some students have been out of class for up to a month. They're asking why there hasn't been a decision to close that school for a circuit breaker.
Yeah, so I've had a number of reach outs, correspondence this week from parents. I had a discussion yesterday with the medical officer of health, who's leading the work by public health on schools and about this school specifically. There have been a number of cases over the last few weeks. Right now, there's only 4 active cases in that school. There has been really no indication of spread within the school, and almost all the cases have occurred from exposure outside of the school. So talking to the medical officer and public health and their work with the school, with that school and the principal, that we feel that school remains safe. There hasn't been a need to close that school down. What they're seeing is a reflection of some of the community transmission in that part of the province, which is starting to tail off. I certainly recognize that the imposition and the disruption that it occurs to children and families, those who are identified as close contacts and having to be home for a week. But there hasn't been any indication of a need to close the school in general and have everybody home. I have to come back to make the point that the way out of this situation with this school and other schools is to continue in the short term, continue the work that we're doing, but it's vaccinating kids. So if you're concerned about your own child and the impact on your child in schools, make sure your child get vaccinated. Do what you can do to support other children getting vaccinated. That is what's going to allow our schools to have the fewest possible disruptions in the coming weeks.
Daryl, do you have a follow-up?
Yes, please. I know there are 5 schools in Amherst, 3 elementary schools, a junior high, and a high school. But when you talk about community spread, it just seems that there's only one school that the cases are coming from. I guess my question is, what does it take for the province or public health to decide to close a school?
So we have certain criteria. Really, it's evidence of transmission within the school, or if we have a case where we've had an exposure that involves multiple classes and then a significant disruption to the school. We have not yet met those criteria in the school in question.
Next, we'll go to Pat Healy with Laker News. Go ahead, Pat.
Hi, this question's for Premier Houston and Dr. Strang. It's being reported that Dalhousie University is not enforcing their proof of vaccination or proof of negative test for students and teachers to be on campus, something they announced they would be doing to ensure campus safety back in August. What are your thoughts on this?
So it's the first I've heard of that. So I'm going to take that and through my colleagues in the Department of Advanced Education, we'll raise that and try to understand that more from Dalhousie the Dalhousie University's administration and their perspective.
Pat, do you have a follow-up question?
Yes, I do. Dr. Strang, what is the process for essential workers in healthcare to present their proof of vaccination to their employee, and is it being done effectively? Are you aware of any ones that have been using fake proof of vaccinations?
So first of all, I'm not aware of anybody using fake vaccination in this. I've heard some reports of that, but nothing's come to me as definitive proof. Each employer has their own specific process about how they would get that proof of vaccination. I think that's been working well. Clearly, as the numbers that the Premier presented show that in healthcare and education, other sectors where we have this vaccination policy, that the large majority of people have presented their vaccine information, and a very, very high percentage of those are vaccinated. And we, as the Premier said, they're going to continue to work, and we will over the next week or so, and we'll present some final data on that. But all the data we have so far would say that this has been a very effective program, and we're getting good reporting of information that shows very high levels of vaccine coverage.
We'll go to Chelsea Gould next with Truro News. Go ahead, Chelsea.
Hello, thank you. Dr. Strang, can you tell us how many doses of the kids' vaccine are expected to arrive in the next week?
Well, I don't have the breakdown. We're going to get multiple shipments of vaccine. We have, the 5 to 11-year-old population is about 65,000, so we're going to need that amount of vaccine times 2. There's no issues at all around vaccine supply. We have lots of vaccine in Canada, and we have every confidence that we'll get the necessary vaccine. Over, as I said, it's some staggered shipments over the next few weeks as we roll it out directly to pharmacies and our other clinics.
Chelsea, do you have a follow-up question?
Yeah, thank you. I'm also wondering about the vaccine supply for adult vaccines in the province. Do you know how many doses there are, and if there seems to be enough uptake for these before any expiration dates?
Again, I don't have specific numbers of doses. Canada has an excess of vaccine. We've heard that from the federal government. Vaccine supply is not an issue in Nova Scotia or in any other province or territory. We have lots of vaccine, so that is, and so we have lots of ability to make sure vaccine is available for whether it's for people starting their primary series. We still have a few Nova Scotians, and encourage those who aren't yet vaccinated to do that. People getting either their third dose, and now for the 5 to 11-year-olds, supply is not an issue.
And finally, we'll go to freelancer Linda Pinozzo. Go ahead, Linda.
Hi, thank you. This is a question for both of you. During the third wave and now the fourth wave, there have been Health Canada authorized monoclonal antibody treatments that were meant to be provided early for people who come down with COVID and are at high risk of serious progression and hospitalization. And during the third wave, the province had 150 doses of bamlanivimab, which was effective against the Alpha UK variant, which was the one circulating here at the time mainly, but only one dose was used. And Health Canada has recently sent Nova Scotia new monoclonals that are effective against the Delta variant. Saskatchewan and Alberta have made the treatments available to those at high risk. In Alberta, it's being administered by paramedics in people's homes. And there's also a pilot project in Hamilton. My question is, why aren't these treatments being offered routinely to Nova Scotians to help them stay out of the hospital and potentially save lives?
So we have a team, Nova Scotia Health, our COVID therapeutics team, experts in infectious disease, is being led by Dr. Lisa Baird. They are looking at all the evidence around various treatments for COVID. I'd have to defer to them of their making the evidence-based decisions around what treatment modalities we have available here in the province for people who require, in hospitalized and require, various medications for treating COVID.
Linda, do you have a follow-up question?
Yeah, I do. The state of emergency, which has now been going on for 20 months, was first declared to help contain the spread of the virus. And the proof of vaccine policy was also described as being time-limited to help us get through the fourth wave. And you did just touch on this, Dr. Strang, but I just wanted you to expand a little bit. What do you need to see happen? And what are the metrics that you're actually using to decide when to lift each of these measures?
So I think, as I've answered before, we look at a number of things. It's not just case number. It's what is the pattern of the time trend. The 7-day average of case numbers. Where is that trending? The percentage of cases that we don't have any indication of where they might have been exposed. We look at our level of hospitalization, both medical and ICU beds that have people with COVID. We look, looking at our vaccination rates, but a lot of it is not just numbers. It's I'm in regular, mostly daily communication with the medical officers of health who are there supporting the public health investigations, and for them, we all look at what is the context in which the transmission is happening. Is very important beyond just the numbers. So we will continue to look at that. One of the most important things, there's two key factors. We still need to have the 5 to 11-year-olds immunized, as we just talked about in detail. That's the next key step. We have to understand that there's a lot of virus activity. It's well controlled in Nova Scotia, but there's lots of virus around in other parts of the country, other parts of the world. We're moving into the winter months, lots more indoor activity, so I think we have to take all that into consideration, and the reality is that to get us through the winter months safely, we're going to have to stick with the program, if you will. The measures we have in place are working. Proof of vaccination, indoor masking are critical. We talked today a lot about the personal responsibility for all Nova Scotians doing what they need to do in their personal measures. We need to continue that to get us safely through the winter months. And then we'll really start to look at where we're at coming out of the fourth wave. We'd hope that would be sooner, but the fourth wave in all reality is here through the winter months, and we'll have to continue to do what we're doing for a few more months.
We can come back to the room for a question or two. We'll start with Jean.
Yeah, Dr. Strang, how long do you think it'll take to vaccinate of those 65,000 kids? Or obviously not all of them are going to get vaccinated, but the vast majority, I would assume?
Yeah, with our capacity in our pharmacies, we looked at the numbers. We should be able to get through the first dose if everybody comes forward, get a high vaccine coverage rates before we get to Christmas. We know that people will be less likely to come out and get vaccinated over Christmas, but we have lots of capacity through our pharmacies, through the IWK, and in secondary measures, if we need to bring them in, that there will be opportunity to get anybody who's 5 to 11-year-old to get vaccinated in the coming weeks before Christmas.
And how far are we away from vaccinating people who are newborns to 4 years old?
So that data is still being, I guess, accumulated through some clinical trials. And there's no timeline on that. I was on a national call yesterday, and that question about under 5-year-olds when they might get vaccinated. There's no timeline at all yet from Health Canada on that because data hasn't been submitted. The clinical trials are still ongoing.
Just to follow up, the before Christmas reference means, like, how many do you want through before Christmas? The majority?
We have the ability. Our target is 80%. So we have the ability if we have 80% of that 65,000, we certainly have capacity in, as I said, our pharmacies, the IWK clinic, to get that 80% vaccinated. And if it's higher than 80%, we'll make sure we have the capacity there as well. That's why we've chosen to go with the pharmacy model. It has shown that it works, it's efficient and effective, and we look at the number of pharmacies and the number of doses that they can deliver within their schedule. We have lots of capacity for the 5 to 11-year-olds prior to Christmas.
Dr. Strang, just a couple of technical questions. When people make appointments for children, will they automatically be booked for the 8 weeks out as was done with adults? For their second shot.
I haven't asked. I'm assuming that's part that we're doing that, but we can confirm that.
Okay. I also have readers asking me when the age limit will be dropped for the third doses from below 70.
The NACI, but that'll be based on NACI recommendations. Right now, NACI is recommending 70 and above. That there is still no scientific evidence that would say we need to be providing boosters for the general public for people below that age 70. Despite many jurisdictions, U.S. and others, doing that, there's no evidence that would say that's necessary this time. Our approach has always been to follow the science-based recommendations from NACI.
Premier, from a technical, I was wondering if I could ask you why you got rid of the chief of protocol position.
Just look, since we were sworn in, we've kind of made a few changes in different departments, and that was just part of a change, just a little reorg in the governments. We want to make sure that everything is effective and efficient, and we saw a need to make a change there, so we did.
Person in that position, your party had criticized his patronage appointment years ago. Was that part of the reason for getting rid of the job?
No, the person's been in that job for a while. That wasn't, it's not a reflection on the person or their abilities or certainly political background. It's just a structure of the government.
That's all the time we have for questions today. Go ahead, Premier.
Thank you so much, everyone, for the questions. And Dr. Strang has reminded us of the importance of personal responsibility. I would say that was kind of a stern reminder delivered in Dr. Strang's kind way. But time and time again, Nova Scotians have stepped up during the pandemic to do what's right to keep themselves and others safe. And we need to keep doing that. Wearing masks, getting vaccinated, and the other public health measures are what has allowed Nova Scotia to return to where we're at, which is pretty near normal compared to certainly to other areas. So, but the reality is, and this is where the personal responsibility comes in, is COVID is still here. And that means we need to keep stepping up, especially as we enter the holiday season and spend more time indoors around family and friends. So please just continue to do what you've done. What makes us Blue Nosers. Do what you need to do to protect yourself and those around you. So thank you so much.